Etopophos Vial is a medication used to treat testicular cancer and certain forms of lung cancer, such as small cell lung cancer. It works by slowing the growth of cancer cells. It is important to follow the dosage instructions provided by your doctor, and take the medication at the same time every day for the best results. Always consult with your doctor regarding the best timing for taking this medication. This medication is typically administered through a slow injection into a vein by a healthcare professional, following the instructions of your doctor. It is usually given every day or every other day for a total of 3 to 5 doses, and this cycle may be repeated every 3 to 4 weeks. One potential side effect of this medication is low blood pressure, which may cause dizziness. If you experience this, it's important to inform your doctor or healthcare professional, as they may need to adjust the injection or slow down the administration. The dosage of Etopophos Vial is determined based on your medical condition, body size, and how you respond to the treatment. Your doctor will regularly monitor your blood counts to ensure that you can safely receive your next cycle of treatment. It's important to attend all of your scheduled medical and lab appointments for proper monitoring and management of your condition. Some common side effects of Etopophos Vial include nausea, vomiting, diarrhea, dizziness, tiredness, weakness, changes in taste, loss of appetite, and pain/redness at the injection site. Your doctor may prescribe medication to help with nausea and vomiting, and eating small meals or limiting activity may also help. Temporary hair loss and mouth/throat pain or sores are also possible. There are more serious side effects that may occur, such as numbness/tingling, vision changes, stomach pain, yellowing of the eyes/skin, and difficulty swallowing. This medication may also lower your ability to fight infections, so it's important to watch for signs of infection and seek medical help if needed. It's important to be aware of the potential for allergic reactions, although they are rare. If you experience symptoms such as rash, swelling, severe dizziness, trouble breathing, or seizures, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. If you are taking Etopophos Vial, it's important to be aware that this medication can cause serious blood and bone marrow issues, such as low red blood cells, white blood cells, and platelets. This can impact your body's ability to stop bleeding or fight off infections. If you experience unusual tiredness, signs of infection like a persistent sore throat, fever, or chills, or easy bruising or bleeding such as black stools or bloody vomit, it's crucial to notify your doctor immediately. Before taking etoposide, make sure to inform your doctor or pharmacist about any allergies you may have or if you have a history of certain medical conditions such as blood problems, liver disease, kidney disease, or heart problems. Etoposide can increase your risk of getting infections, so it's important to avoid contact with anyone who has an infection that can easily spread, such as chickenpox, COVID-19, measles, or the flu. This medication can also make you more susceptible to getting cuts or bruises, so be cautious when handling sharp objects or participating in activities that may result in injury. Etoposide may cause dizziness, so it's best to avoid alcohol and marijuana while using this medication. It's important to also be mindful of your alcohol consumption to lower the risk of stomach bleeding. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the medications you are taking. If you are a woman of childbearing age, it's important to discuss reliable forms of birth control with your doctor while using this medication, as it may harm an unborn baby. Men using this medication should also inquire about reliable forms of birth control during and after treatment. If you are pregnant or breastfeeding, consult your doctor before using etoposide. When taking Etopophos Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. This is why it's crucial to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's also important to consult your doctor before starting, stopping, or changing the dosage of any other medications. This can help ensure the safe and effective use of Etopophos Vial while minimizing the risk of potential interactions. If someone has taken too much Etopophos Vial and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. When using Etopophos Vial, it's important to have regular lab and medical tests, including a complete blood count and kidney/liver function tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Make sure to take Etopophos Vial exactly as prescribed by your doctor. It's important to take it on time. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to create a new dosing schedule. Be sure to follow the product instructions and ask your pharmacist about how to store Etopophos Vial. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or drain unless directed to do so. Properly discard this product and it is expired or no longer needed. Ask your pharmacist or local waste disposal company for guidance on proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.